Good afternoon. I am Director Hwang Dae-neung of KPIS. I will introduce our Pharmaceutical Distribution Information Management System. I'll begin with the overview of KPIS, followed by standardization of pharmaceutical information, collection and management of pharmaceutical distribution information, and utilization. First part is the overview, which is the purpose and role of KPIS. What is KPIS? KPIS was established to collect, investigate, and provide pharmaceutical distribution data encompassing production, import, and consumption of pharmaceuticals in 2007. The bases are in Pharmaceutical Affairs Act, and enforcement decree of the same law has the fact that HERA is designated for the holder of KPIS. The reason HERA was designated to take care of KPIS is that because HERA takes care of claims review, we already have experience of managing drugs, and we also have experts in the area. That's why HERA was designated for this function. This is the history of KPIS. Since the establishment in 2007, we began to collect production, import, supply record of pharmaceuticals, and introduced serial number based reporting system. And in 2015, serial number labeling became mandatory for prescription drugs. In 2016, it became mandatory for pharmaceutical companies to report serial number of prescription drugs, and the same became mandatory for wholesalers as well in 2019. This is the KPIS's main businesses. There are 4 elements: standardization, collection and management of data, post-management of data, and data analysis and sharing. First part, the standardization. We assign identifiable number and code to each medicine. We use KD code and barcode or RFID tag. Second function is collection and management of data. We collect the record of production or import, and also controls the supply record of pharmaceutical companies and wholesalers. Third part is post-management of data. We want to double-check whether the supply record actually matches with the actual transaction. And we also check it against the benefit claim. We want to see if the price is the same with the records of supply and on our claims benefit. With the data, we support that to the government for policy making, or it's shared on our website, and other public organizations can use our data. This is the workflow of KPIS. We receive the data on supply and import from pharmaceutical companies. Also, wholesalers submit the record to us through the network. The benefit claims and MFDS data are connected. Government uses our data for statistics production and policy, and also sometimes it's used by prosecution's office and policy agency and the National Tax Service. Pharmaceutical companies can use our data for their research, and public organization can use it for benefit claims review. For pharmaceutical companies, they can use our data to understand the market size and expected number of patients. Second part is about standardization of pharmaceutical information, consisting of KD code assignment and barcode and RFID. First, the KD code. It refers to Korea Drug Code. This is assigned to all drugs. So for all pharmaceuticals distributed in Korea, standard codes is assigned and attached. We have 160,000 KD codes as of 2019, and the number of items were 54,000 items. For KD code, we use GTIN13 system. So the first 3 digits are country code, and Korea's country code is 880. And the next 4 digits is for company identification, and the next 5 digits are product code. First 4 refers to the ingredient, and the last digit is package unit, and the last of the last digit is for verification. We eliminate the country code and verification number, and the rest 9 digits is used for claims code. From Korea Chamber of Commerce, the importer or manufacturer receives company code. They apply for approval on the item to Ministry of Food and Drug Safety. If they are approved within 30 days from the date, they have to register on KPIS website. Then KPIS has to assign KD code within 10 days and notify the KD code. But in reality, it's actually much faster. We want to enable fast market entry for companies, so we does this announcement every Tuesday and Thursday. Barcode and RFID. All pharmaceuticals in Korea have to have barcode or RFID. For over-the-counter drugs, it is okay to use just KD code, but we insist using GTIN13 code. For prescription drugs, it needs to have KD code, lot and batch number, expiration date, and serial number. So we have to use GS1128 code. Barcode is a symbol that holds a 13-digit KD code. It has black and white parallel bars or data matrix. And barcode scanner can read information of the barcode. There are 2 types. The combination of white and black parallel bars, that is the first example. And the second example is the data matrix consisting of arrays with square modules. This is RFID. It uses the radio frequency identification. It has antenna and chip within the RFID tag. It's a size of coin. This is hidden in the package or in the box, so it's not visible from outside. Barcode has to be read one by one, but RFID can be read in bulk with one reader. So it's more convenient in logistics, but the cost is higher for RFID. This is the management history of barcode and RFID. In 2009, it became mandatory, and in 2010, for certain designated drugs, such as narcotics, they became mandatory. And in 2013, marking became mandatory for prescription drugs. And pharmaceutical companies can choose between barcode and RFID tag. In 2015, the serial number labeling became mandatory. Third part is collection and management of pharmaceutical distribution information. It includes pharmaceutical manufacture, import performance management, pharmaceutical supply record management, and serial number reporting system at shipping. This is about manufacture and import record. All finished pharmaceuticals are target. Reporting item is month of production, product name, KD code, production amount, production cost per unit, and production cost. The reporting process is the manufacturer or importer reports to the association, and the association reports to KPIS about manufacture and import. This is a quarterly report within 2 months. If you look at the performance, we can see the numbers are increasing every year. About the reporting of supply, this has legal basis on Pharmaceutical Affairs Act. All finished pharmaceuticals have to report, and it has to include who, when, and what, and how much. Also, how this supply record was contracted. This is the management of pharmaceutical supply record. This is the size of the market. As of 2019, we see the 60 billion USD in 2019, and there are 3,300 suppliers. Pharmaceutical companies and wholesalers are in the market, and there's also size of supplied drugs on the bottom side of the slide. The supply comes from manufacturer directly to healthcare institutions, or sometimes it goes through wholesaler and and healthcare providers, and sometimes there are more than one wholesalers in the process. This slide shows about the serial number reporting system. We give out the serial number so we can track all the stages of distribution until the drug is used by the consumer. All drugs and all suppliers are target. All importers and manufacturers and wholesalers are in this system, and this is for prescription drugs, and the reporting timing is at shipping. There are different roles for pharmaceutical companies. They have to add and attach the serial number when they receive the drug, and when they ship, they have to report to KPIS. Wholesaler as well, when they ship, they have to report. This is a flow chart of the same fact. Pharmaceutical companies and wholesalers, every time they ship out the medical supply, they have to report to KPIS. The serial number reporting system has been prepared for a few years. It began in 2015, and to enable soft landing, we gave them a grace period of 6 months for manufacturers and importers. Originally, they have to report at shipping, but they had grace period of 6 months, so they can report up until the end of next month. And for the wholesalers, the grace period was longer than pharmaceutical companies, which was a year and 6 months. The serial number reporting system has different purposes. We want to track all the stages of drugs so we can prevent unsafe pharmaceutical and illegal distribution. So we can create safe pharmaceutical distribution and usage environment. This is how we track the distribution with a serial number. After shipping, during the process of distribution, there can be counterfeit or there can be unsafe drugs. We can put a halt immediately when we are informed of this fact. And we can also track where this drug is because we have this history and tracking system. So the pharmaceutical company can withdraw the supply of drugs. The patient is protected from using the unsafe drug. Next part is about utilization of pharmaceutical distribution information. COVID-19 has hit the world hard, and we are tracking the pharmaceutical distribution related to COVID-19, and we track unsafe pharmaceutical distribution management and prevent illegal distribution pharmaceutical. Let me go over one by one. First of all, as to COVID-19, we are monitoring the drug use. Depending on the change of situation related to COVID-19, the interferon and ribavirin, there are 35 items. They are covered by National Health Insurance. So we could track the supply history and we can safely provide the drugs to healthcare providers. By building this system, we can also understand where stocks and where in shortage of the drugs. We are reporting this daily to Ministry of Health and Welfare and Central Headquarters. When there was a Daegu Gyeongbok cluster outbreak, there was a severe difficulty in procuring drugs, and that is why we started to running this tracking program. We work with the suppliers, and our providers portal provides the information of the drugs, who has this drug, and it also shows the address or contact number of the supplier, so they can freely contact the drug supplier when they're in need. This is a diagram about monitoring status. The amount of stock and planned import, volume of stock. So when we understand this volume of drugs, we can estimate how much we can deal with. For example, Calatrotep, as of March, the volume of stock was 600,000, and the actual distributed amount was 65,000. And according to DUR, the daily use was about 1,000. So we could predict that we could treat 1,174 patients in case we need that drug. We have unsafe pharmaceutical distribution management system. We can block certain drug distribution, and we acquired patent license on distribution prevention system for tracing serial number and unsafe pharmaceuticals. If a drug is a target of withdrawal or this drug has expired, we can quickly withdraw the drug, and we can inform the pharmaceutical company ASAP. In 2019, we prevented 1.66 million unsafe pharmaceuticals. Unsafe pharmaceuticals, when it is confirmed, pharmaceutical companies should be able to withdraw immediately. Before this system, the pharmaceutical companies could not identify where the unsafe drug was, but now KPIS can track down and where it is, for example, at wholesalers' warehouse, and we can inform the pharmaceutical company about where this drug is, so they can easily withdraw. We also prevent illegally distributed pharmaceuticals. About post management, when the supply record, we sometimes go out on site to check whether the reported supply matches with the real trade record. We can check their document and compare to see if the reporting was genuine. If there was any violation or illegal distribution, we can impose suspension of license and other administrative measures. We can issue warning letters as well. These are examples of illegally distributed pharmaceuticals. First one is the detect illegal distribution of Atomidate, which is like the second propofol. We heard that the Ministry of Food and Drug Safety was informed of this fact, and they requested cooperation to HERA. Using the serial number, we could track down the data. The importers and pharmaceutical companies were investigated, and we identified this illegal distribution. And also the second case shows the sales of anti-obesity drug called Saxenda. This was also, there was a suspicious case, and HERA was requested to aid their investigation. So we used the serial number investigation and found where the internet sales was happening, and we found the 500 million Korean won worth of illegal distribution. This part is about claimed pharmaceutical fee of providers. We provide reimbursement to pharmacies, and that data comes to KPIS as well. So we can check how much was paid to pharmaceuticals for drugs, and we can cross-check the claimed amount and provided amount. If there is mismatch, we can ask for more explanation. The reason we conduct these investigations is to induce safe and solid pharmaceutical culture, and we want to prevent any financial leakage. We want to make safe pharmaceutical usage culture. On the table, we can see that the return amount is the amount of saved budget for us. Lastly, we have an app. The public can easily check whether this drug is unsafe or hazardous. There is a barcode on the drug, and the user can take a photo of that, and the app will let you know everything that you need to know about the drug. We also publish finished drug distribution information statistics, which is annually published. And we also work with NHIS, MFDS, and other drug-related public organizations. Thank you.